Hello, we are Group 10B and we'll be talking about the removal of data waiver requirement for the prescription of buprenorphine. Here is a bill overview. Previously, providers were required to provide a notice of intent to the DEA and receive an ex-DEA number signifying that they were authorized to prescribe buprenorphine for the treatment of opioid-use disorder. Section 1262 of the Consolidated Appropriations Act, also known as the Omnibus Bill, removes the federal requirement for prescribers to have an ex-DEA number or data waiver to prescribe medications for the treatment of OUD. Effective immediately, all providers who have a current DEA registration that includes Schedule III authority may now prescribe buprenorphine for OUD if their state allows. This does not affect state law, however, which may differ from federal law. What does this mean for providers? Here are some frequently asked questions for what this bill means for providers, their prescribing abilities, and training requirements. Doctors must have a one-time training of 8 hours on opioid or other substance use disorders when applying for or renewing DEA registration to prescribe C2 to C4 medications. Does this apply to methadone? No. Methadone must still be dispensed through a certified opioid treatment program. Are there limitations for the number of patients a physician can treat? No, the bill removes the limitations on how many patients a physician can treat. They can now treat as many patients as they can support. Are there any reporting requirements? All federal reporting requirements previously required by the data waiver have been removed. What if my state requires a data waiver? State laws may become more strict than federal law and require providers to still have a data waiver. Providers should check with their state health departments prior to prescribing. Does this include PAs and NPs? Yes. Any prescriber that has a valid DEA registration can prescribe buprenorphine for OUD as long as it complies with state regulations. What does this mean for patients? Increased access. More providers with no limits and the ability to prescribe means that more patients can be treated for OUD. Removal of the waiver can also broaden the group of providers that can and will prescribe. More flexibility. Patients can receive treatment for OUD along with their regular therapies and do not have to find a separate provider with a data waiver. Destigmatization of OUD. Placing buprenorphine behind a waiver can make it intimidating for patients. Removal of the waiver can remove the impression that treatment is complex or dangerous. What does this mean for pharmacists? Increased demands. More providers who are able to prescribe means a higher demand for these medications over time. Pharmacists may need to be wary of prescriptions and will need to manage inventory as necessary. Easier interventions. If a pharmacist believes that a patient is suffering from OUD, they can correspond with the patient and their usual provider, allowing for better coordination of care. Expansion of role. Currently, 10 states allow pharmacists to prescribe buprenorphine for OUD. The removal of the data waiver could create more opportunity for pharmacists to intervene in the opioid epidemic by prescribing and dispensing to patients. Confidence in counseling. Pharmacists have reported lacking in confidence when speaking with patients about resources for OUD. Reducing barriers for obtaining treatment will increase pharmacists' confidence when counseling and offering options to patients with potential substance abuse. Thank you for listening to our presentation, and here is our references. We look forward to hearing your questions in class. Have a great day.